So welcome everyone. Thank you for joining us over here. Welcome to the Dog and Cat Coalition session of AfA CONNECT, where we'll be discussing how to engage the government for effective and sustainable TNVR programs in Asia. Trap, neuter, vaccinate, and return programs for cats and dogs across Asia are not new. However, in order to keep TNVR programs effective, humane and sustainable government and community involvement in TNVR is essential. Today, we'll be joined by two fantastic speakers who will share their lessons and insights on developing government partnerships, implementation strategies, and how to monitor and evaluate programs for the welfare of dogs and cats, the communities, and government partners. My name is Elliot Carr, and I'm the lead coordinator of the Sanctuaries and Rescue Centre Coalition, and today I'll be moderating this event. Here's a general overview of today's session. Sadly, we were due to be joined by Dr. Rashad Asghari and Pen Farthing with the Nowzad charity in Afghanistan. However, they were called to urgent government meetings, and as everyone on this call would appreciate today, that takes priority. Our session today, if you have any questions, please add them to the chat, and our staff behind the scenes will transfer them across and make sure we ask those questions in our Q&A session at the end. I would like to very much thank our first two speakers for joining us, Matt Backhouse from Four Paws International and Dr. Elly Hiby from the International Companion Animal Management, or ICAM Coalition. So our first speaker today will be Matt, who is the head of Stray Animal Care Southeast Asia for Four Paws International. As an experienced companion animal management professional with over 15 years of experience, Matt has expert knowledge of the dog and cat meat trade, rabies control, and humane population management. Today, Matt will be sharing practical perspectives in engaging with the government on TNVR. So Matt, when you're ready, please share your screen and unmute yourself and join us.
Brilliant. Thank you, Elliot, for that introduction. So give me 1 second. Let me just make sure this works. Okay. So can you see my screen okay?
Looks perfect.
Excellent. Okay, great. So yes, thank you. So welcome everyone to this AfA session today. I'm really pleased to be here. I appreciate being invited to speak to you all. And as Elliot said, questions are most welcome. We're going to have question and answers afterwards with myself and Dr. Elly. So please feel free to ask anything you like. And hopefully we can have some good discussion and some helpful outcomes. So I'm going to talk about some of the practical perspectives related to how we engage the government on these humane, sustainable TNVR or CNVR programs. Same, different letter. So yes, I'm going to talk today about a few different things. So I'm going to look at some common problems, which we will see when we're working on these stray animal management issues. Then I'm going to talk about how we understand and look at local situations, mechanisms for change. I'll explain a little bit more what that means later. Monitoring and evaluation. I'm only going to touch briefly on that because Dr. Elly is doing a second presentation in much more detail after mine. Then how NGOs and government can work together, what training and capacity building might look like and why it's important. Resource issues, that's on both the NGO and the government side. And then some conclusions and leave space for questions at the end. Okay. So some of the common problems that we are likely to see are not going to be new for many of you joining this call, particularly if you've been working in stray animal, dog and cat issues for some time. I think what's interesting and important is to note where the common problems are and how that can change in certain regions. So for example, here in Southeast Asia where I work, principally in Vietnam, Cambodia and Indonesia, the dog and cat meat trade, as you can see here, these two pictures are from dog and cat meat holding areas in Cambodia. This is one of the most serious animal welfare issues in this part of the world, and it's responsible for the deaths of over 10 million animals just in Southeast Asia. That number across Asia generally is closer to 30 million animals. It's important here to understand that that really impacts our stray management programs, our population management efforts. because any of these animals that might be living in communities, they might be owned roaming animals, they might be people's pets, if they are being taken, removed out of those populations and then killed for their meat, often transported hundreds of kilometers, sometimes even across international borders, that has a massive impact on our population work. So it's a really important one to think about. Many of the other common problems, such as neglect, abuse, whether that is deliberate or just because these animals don't have anybody kind of looking out for them or anybody caring for them, these are issues that we also see, such as malnourishment, skin diseases, parasites, ticks, fleas, accidents, things like that. Another one as well that's worth thinking about is sheltering, and specifically mass sheltering. So the image on the screen at the bottom here is from a shelter in Thailand. Many of these animals were actually rescued from dog meat trade trucks and then transferred to shelters. But we see other problems here with shelters in that often it's seen as a tool to assist with population control, very often by the government and by other regional and provincial authorities, just putting huge numbers of animals into shelters, which, as is well evidenced, is not a sustainable or practical solution to stray animal issues, and actually results in more animal welfare issues and more problems in the long run. So this is why it's always important. So why I want to talk about practical perspectives is, how do we think about what kind of work we need to do, what kind of relationship we want to have with government stakeholders, and go from there? Because often you see many organizations are responding to a need. They see animals in distress and they kind of launch a program, they kind of get to work, and then they, for a while, will work on the programs, but then try to reverse engineer these sort of cooperative efforts with government. I think it's important to plan first, to understand firstly what legislation exists. Are there any laws where you're working which promote or advocate for humane, sustainable population management? On the other side of that, are there any laws against sterilization, which you might need to understand? Do certain localities, at a national, regional, or even village level in some cases, have laws about how animals should be treated, about vaccination, about registration? And then who are these relevant agencies and decision makers? Who are the people in government that you need to speak to? And that, for me, is one of the key parts, to have an understanding of stakeholders, an understanding of who is the right person, who is the responsible body. Is it the animal husbandry? Is it the food and livestock? Is it, and on and on. It could be many other different entities that you need to work with and build those relationships. So it's important to know who those people are when you're looking at working with government. Then also understanding what other NGOs and private sector veterinarians work in the same area. If you start working in a large city, for example, it might be the case that there are other groups already working there. Your paths just may not have crossed. An example I can give from Thailand, there was a group working in one part of the country, and when they were sterilizing animals, they weren't marking them in any way. There was no ear notch, there was no tattoo. And then a second group, 6-8 months later, were catching animals to sterilize, anesthetizing them, getting them all ready for surgery, and then realizing, oh, I think they've been sterilized already. So obviously that's stressful and dangerous for the animals. It's unnecessary, it's a waste of money, and it's a waste of time. So really looking at the scope of groups, organizations, and people working, and trying to, even if you don't work together, at least understanding and coordinating so that your effort and your impact is multiplied. So then knowing what the community feels about stray animal care. This can be a difficult one because it might change over time. There might be negative perceptions about stray animals because of large populations. People may be afraid of them, there may be bites, there may be rabies, depending on where you work. Or it might be that the community is very strongly invested in their animals and you need to work with them, you need to cooperate with them when trying to launch programs and work with any local authorities. So all of this is to say, look to the local experts, try and speak to people and understand what resources you have kind of on your doorstep from NGOs, from private, from community, and from government level, and bring all of that expertise as part of your planning process. So I'm just going to take a quick moment just to say a thank you and give some credit and acknowledgement to the amazing team of women that I work with here in Southeast Asia. So these are our stray animal care coordinators across Thailand, Vietnam, Indonesia, and Cambodia. And these are the people that I'm talking about when you're talking about local expertise. Living and working in communities, connecting with all these different people, and really being able to bridge between organizations, governments, and communities. So without people like this, we really wouldn't achieve the goals that we have with 4PAWS. So I'm going to take a little moment to thank them all and embarrass them in public. Okay, and so just as a little bit of more context, what 4PAWS does in Southeast Asia is we work with a number of different partners. We have a partnership program, all of them working on different aspects of stray animal care, and we support these organizations with all of the things that we've been talking about to really amplify their impact and to make sure that we're connected with communities and designing programs as best we can for where they are. Also, international coalitions, groups, and tools. Like, you can find so much amazing information. Today is the perfect example. These AfA CONNECT sessions are an excellent example of how you can share knowledge, you can get together, and you can really work with other people's expertise. I've also listed a few of the bigger coalitions and groups. We're going to provide links for all of these in the chat, so don't worry, you don't have to search out and find these. But these are just a snapshot of some of the online resources that not only you and an organization can use, but that have the capacity to be implemented at the government level, even at national level. Many of these tools are designed to assist national governments in not just their rabies control programs, which kind of leans heavily for Southeast Asia, but they're underpinned by some really good other tools for population management overall. So once we kind of looked at the area, we kind of know who we need to speak to, we've thought about all these things. Another thing that we need to consider is, what are the mechanisms for change? What are the reasons that the government will have to implement humane, sustainable population management strategies? Because for people working in animal welfare, for people who care about animals and want to see their welfare and their lives improved, we have a strong drive, at least for me. I would say that's my strong drive. But I need to understand that people in government might not share that same perspective, and the priorities of the government officials might be different to those working in animal welfare. So we need to identify other issues that we can use and that we can talk about. So public health and safety, this is a very strong argument, and this is a priority for a lot of government bodies. They want people to be safe, they want them to be protected, and so this is where we can use that conversation to say, with all of the expertise, all of the knowledge that we have, implementing these humane, sustainable programs is better for public health and safety. Reducing burden on shelters. Running shelters full of hundreds, sometimes thousands of animals cost a lot of money. It's difficult, it's resource intensive. So again, we can say, maybe there's a better way we can work together to offset some of this burden on these shelters and implement different strategies. Preventing zoonotic disease, again, as we see from COVID over the last 2 years of that pandemic, there is more understanding now about zoonotic disease and the sort of transmission of disease between animals and humans. And then we also need to understand the scale of the problem. So this is an important point. How many animals are there? What is going on in these countries? Where are the most affected areas? What is the problem? And again, asking people in these various government bodies what they perceive the problem is, and working together so it's not just a one-sided conversation. I think also I think in one of the other sessions, there's going to be some speaker talking about One Health, One Welfare and climate change. One Health is also a really important talking point with government now as we look at how holistically all of these issues between animal health, human health and environmental health are interconnected. I'm not going to go into this in much detail. There are lots of good resources I'm happy to share after the presentation. But it's important to note that this is something that government bodies will understand and will recognize. And if we can include One Health in our planning and our thinking about our animal welfare programs, we have more chance of success in long sustained corporations. And again, just another re-emphasis that many of the pathogens and diseases that affect humans originate from animals. And this isn't to make people afraid of animals, this is just to make people understand the importance of designing these programs in the long term in a humane, sustainable way. So I just wanted to give one more example about a mechanism for change, or two actually. I'm going to give two more examples. In Hoi An, which is a city in central Vietnam, Four Paws was working with the local People's Committee to phase out the dog and cat meat trade in the city. This has been really successful. Over the last 2 years, we've had really good successes working on that program. But we also had a lot of success in providing free sterilization and vaccination to community animals, to people and their animals within Hoi An. So as well as reducing dog meat trade, we reduced the number of unwanted animals, we reduced the amount of animals that could be stolen to provide meat for the trade. So these kind of different levers that we're investing in our government partners, we're investing in those communities and we're helping, and it's positive outcomes for animals all around. Another way that we approach the same problem is working with veterinary universities. So in Indonesia, through our partner in Jakarta Animal Aid Network, implementing animal welfare as part of curriculum into some of the veterinary universities, allowing vet students to intern and to work in our partner shelters and to receive that kind of education and training about not just animal welfare, but why population management is important. Veterinary students are the people that are going to be representing the veterinary community, and they're going to be cornerstones of their community in thinking about how animal populations are managed in future. So this is another good way to find a kind of different route to the same outcome, which is implementing long-term, improved, sustained programs. Like I said, Dr. Elly is going to follow this one and do a very comprehensive presentation about monitoring and evaluation. But I just wanted to touch on it briefly because when I mentioned as well previously, understanding the scale of the problem, one thing that we have found in many of our corporations with government authorities is that they don't accurately understand the animal populations that they have. Often, it's household surveys is the single kind of metric of how many animals exist in a town, city, province, whatever. That fails to account for such a high number of animals in many places. And so we can then offer to do training, we can share these resources, some of which I've had on the previous slide, and we can demonstrate how effective comprehensive survey and monitoring and evaluation is important because, take an example, if you do a household survey and you find in a city there are only 2,000 dogs, but you do a proper comprehensive street survey where you really understand the scale of the population, you might find that there's 8,000, 10,000. So if you're basing your intervention on 2,000 animals, of course, it will never be successful. So it's important to really understand and use data to design effective programs and to communicate that with your prospective government partners. And again, here, just another couple of examples from surveys that were done on a smaller scale in Bangkok and projects we ran last year. And getting some feedback from the community, understanding why people might not sterilize their animals, and sharing this with your government partners as well. Because often the answer is, well, if somebody has a cat, they need to go and get it sterilized. It's up to them. But as you can see here, many people don't know how to do that. They don't have the money to do that. They have no means of transport. So these are important barriers to understand and to communicate and share. So collaboration is an important part. And I think here it's important to recognize that NGOs and animal welfare groups cannot be responsible and cannot take the load of an entire country. It's just impossible. It has to be done together with government authorities. But we have here an example from Bangkok where we worked in a temple, worked in a community, and did that with the support of the local authorities to fill gaps where they didn't have capacity. So in this temple that I'm showing photos of here, there is a small government clinic on site, but they can only sterilize 2 to 3 cats a day. So in one weekend, with our team of vets from our 2 partner charities, Bangkok Cat Society, Atlanta Animal Welfare, we sterilized over 100 animals in 2 days. This then builds positive relation with the community, it helps the cats, it builds relations with the government, and so these kind of things are a really good example how we can help. Also in Thailand, we provide training and capacity building. So in speaking with many people in the government, we recognize that the things that we take for granted, best practice sterilization, aseptic technique, surveying, humane handling and catching, often it's not taught to the people that are working in many of these organizations or in these kind of government roles. So providing training where we can ask what is needed, we can build that capacity. Here we have a gentleman from the local, I think he's from the Livestock Development Office, learning how to safely and humanely net a dog for sterilization. These are all important practical skills that then can be used by our partners in the government. And here as well, teaching about population dynamics, survey methodology, to address the problem that I just spoke about, when often many of these government officers don't know how to do this and are underestimating animal populations. So the last thing I'll say just before I wrap up is it's also important to recognize there are resource issues, not just for NGOs, not just for animal rescue groups, but for governments as well. We've worked with authorities and they understand the problem and they understand the scale, but they don't have the money to do anything about it. So I think we can acknowledge that. It's not to say that we can fund that, but we can also work together to make the case and present our best practice and our findings and our data to the people that decide on budgets and are responsible for the budgets to make a stronger case to invest in these humane sustainable programs for all of the reasons that I've just summarized there. So that was a whistle-stop tour. I hope that was helpful. Thank you very much for listening. And now I'm going to pass back to Elliot. Thank you.
Thank you so much for Matt for that. Yeah, that whistle-stop tour of all your work and some really great strategies there. I think one statistic that blew my mind when you first said it was 30 million dogs and cats are entering them. Like that's absolutely insane. And I've popped down a couple questions even from my head into for the Q&A session later. I think the other really important point you made right back at the start was doing your research before you enter in an area, which I think a lot of very passionate people come in like, we want to make change, we want to do something, but understanding your policy landscape is really, really important. And then also understanding local context so that you can actually effectively do something and finding those metrics which the government are actually interested, or what's your way into listening to them. So anyway, thank you very much
absolutely.
for that.
Yeah, no worries, most welcome. Thank you.
If anyone has any more questions, please continue to pop them in the chat and we'll collect them for the Q&A at the end. Otherwise, I'd like to welcome Dr. Elly.
Good
How are you
morning,
doing?
good afternoon. Good, thank you.
Good afternoon. So to quickly introduce you, this is Dr. Elly Hiby, and she's the director of the International Companion Animal Management Coalition. Previously, she's worked for international NGOs such as the Dog Trust and World Animal Protection, leading companion animal welfare programs and advising on humane dog population and rabies control. She has also worked as a technical expert with the World Animal Health Organization, the World Health Organization, and Food and Agriculture Organization on dog population management. That's a pretty decent CV you've got there. Today, Elly will be speaking on the vitally important area of using data and how to measure the impact of TNVR programs. So whenever you're ready, please share your screen and begin.
Thank you, Elliot. Let me just share this, make sure it's the right one. Can you see my screen okay?
Looks perfect.
Awesome, thank you. So yeah, definitely a thank you to Elliot and also widely to Animals for Asia to inviting me today to join this Connect session and get the chance to meet so many of you. Today I'll be giving a very brief introduction to ICAM and how we perceive the role of CNVR, TNVR, TNR, ABC, whichever term you wish to use. As Matt said, there's a number of different terms we could use here, all of which basically mean the same thing. And then I'm going to go into monitoring evaluation. So how do we collect data against indicators that matter to us, but also matter to governments, with some examples from projects and suggestions for practical and simple methods of measurement. So we move on. Okay, but let me start with this sort of quick introduction to ICAM. So we were first formed in 2006, and our members are all international charities or international specialist groups. You see their logos up at the top, and they include 4 Paws, of course. And our mission is to support the development of humane and effective dog and cat population management globally. We publish joint guidance documents. Here is a selection of 3 of those. We run conferences and webinars. If you haven't yet signed up for our 2024 virtual conference, please know the registration is live. It's free. It's on our website. It's just 2 hours per day for 5 days, and that's June 17th to the 21st, so just under 2 weeks to go. So I hope you'll join us there. We also host free online courses. So we've got 3 at the moment. One is a course on how to be a mentor to a multi-stakeholder group that wants to plan and implement DPM, including government, including how to keep them working together, which I'm sure some of you experienced the challenges of trying to maintain cohesion within a multi-stakeholder group. This course helps you to do that. And then there are 2 courses that are on DPM more broadly. One is for implementers of DPM, and one is for policymakers. And finally, we also develop tools. So one example here is Talea, which means count in Latin, which is an app designed for conducting street surveys of free-roaming dogs or cats, which I'm going to mention again later today. And I think you'll already have seen the link to the webpage that shows you how you can sign up for Talea. I did want to start with a clarification for how we perceive CNVR fitting within that wider dog and cat population management system. So in this diagram, we have this collection of services or measures in green, working together as a system, and then they're underpinned by foundations, which are in blue at the bottom. And those foundations support the services to be sustained long-term and to be used effectively. And you'll see that CNVR isn't actually called out by name here. We present CNVR as a way to deliver reproduction control. In many communities in Asia, it will be a leading intervention in how the majority of sterilizations are conducted each year. But that's not the case in all countries, and this is a concept of DPM that should work globally. So importantly, CNVR doesn't stand alone. It's part of this comprehensive system, and that's because population management systems don't just work to influence the breeding of animals currently on the street. It also has to consider other sources of future street animals and work on those too, so that we're working not just on symptoms, but also on all causes. So just to explore this a little bit further, this is a visualization of basic dog population dynamics. So it shows the different subpopulations of dogs or states. It also shows processes. So demographic processes are part of dog population dynamics. They're the way that dogs arrive and leave the population and how they move from one state to another. And that includes birth and death and movement out of the home, either temporarily in the form of roaming or permanently when lost or abandoned. And when we bring in CNVR, what we do is directly impact these processes, the birth rates within the community and unowned dog subpopulations, which is really important. Where these are a significant source of the next generation of free-roaming dogs, this is very impactful on future numbers. It also prevents the suffering and dying of many puppies, but it does not impact those other processes. So if you also have plenty of owned animals that are allowed to roam, they get lost, or perhaps they're unwanted owned animals, including puppies of unwanted litters that may be abandoned, and then your CNVR impact will get blunted. Now, I'm not saying that NGOs should be responsible for implementing all the services required to influence all these processes. Different stakeholders will have different roles and specialities. So it's perfectly appropriate for an NGO to lead on an intervention like CNVR, whilst government is working to deliver other services. It's that comprehensive set of services and stakeholders that make up the effective system. So where an NGO is delivering a CNVR project, it's important to point out the role that CNVR will be having, but also to point out what else is left to be done. And what we should not do is claim that we are solving everything with CNVR. It's an important contribution, but we must continue to advocate for the rest. Now, there are two very important additional processes that CNVR can influence, and those are removal from the street to shelters and culling. And CNVR presents a humane alternative to these two stray control processes. Now, I did want to flag up the World Organization for Animal Health standard on dog population management, which is chapter 7.7 of their terrestrial animal health code. Now, this is not legally binding, but the veterinary authorities in 183 countries have signed up to follow WOA standards. So this is still influential, and it can be a useful document to lean on when advocating to governments for CNVR. So since May 2022, this chapter has included a clear section on CNVR that states that it is an alternative to removal. It does also state that this is not a standalone solution for the reasons I mentioned previously, but this is a strong supporting statement for the use of CNVR. Note that they are just talking about removal here, by which they mean removal to shelters in this particular document. But the chapter does also not support the use of culling as an approach to population management. So CNVR is in effect promoted as an alternative to removal to shelters or removal for culling. So I'd now like to talk about impact and how monitoring indicators can help us evidence that impact, which we may need to do for many reasons, including to secure government funding or supportive policies, to establish public support for our work, and also to help us to learn which of our interventions are working and what needs adaptation and improvement. So in this ICAM guidance document called Are We Making a Difference?, we describe 8 commonly stated impacts of DPM systems and provide guidance on how to measure them all. But today, recognising that we're focusing on CNVR, I'm going to hone in on just these 4, which are probably the most relevant for CNVR. So the first step in monitoring and evaluation is establishing what impacts your intervention is aiming to have. Now, that might sound simple, but we often become quite transfixed on the very hard job of achieving outputs, like the number of dogs or cats that have been caught, neutered, vaccinated, and returned. And we forget to look up at the horizon and state what impact we're actually trying to achieve. What is the change that we want to see? Now, these impacts, changes, goals, aims, again, you pick whichever term you prefer. They're often quite broad statements like improved dog or improved cat welfare. The job of indicators, also known as metrics or key performance indicators, is to make those impacts measurable. So here is one example of an indicator for each of these 4 impacts. Now, ideally, you want 2 or 3 indicators for each impact so that you are not relying on just one and can do what is called triangulation. That is looking at more than one piece of evidence for the same impact, but that's an ideal, it's not essential. And key to selecting these indicators is to have a method of measurement that is robust and repeatable. And so by definition, needs to be simple and affordable, because you'll need to keep repeating it. So here are some examples of methods of measurement. We have street surveys coming up for the first 2, which I'll talk through in a moment. And for the third, we see a method of measurement that relies on someone else. It's a secondary source of data because someone else, the hospital in this case, is doing the data collection. Our job is to establish regular access to that data, and that will probably require a direct contact with the hospital. The final method is probably the most time-consuming, and that's a household questionnaire. Now, I'm a big fan of street surveys because they can be really affordable and provide data for several indicators. I think many people are nervous of street surveys because when they are used to calculate an estimate of the total dog or cat population size, there are complexities. You need to be careful how you set up your sample and careful about your subsequent analysis. And there are several options for analysis, so you do need a bit of experience. But there is a simple option for street surveys. You can establish a convenient route that traverses those areas that you know are hotspots for dogs or cats, and where you'll be focusing your CNVR effort. And then simply repeat a count along those routes, ensuring that you keep the protocol the same. So starting at the same time of day, using the same means of transport, avoiding days with unusual weather or events like public holidays, basically trying to ensure that any change in the number of animals you count on your route is reflecting or indicating a change in the wider population of those animals. So I don't have time to go into the details of how you set up a route and what details you might want to record on your survey, but please, if you're interested, do check out the Talea webinar on this link. In the second presentation of that webinar, you can hear me going into much more detail on how you can set this up. In that presentation, I am in particular talking about using Talea, which is this free Android app designed by ICAM in collaboration with an organisation called Wise Monkey. And you can sign up for your own Talea project on this page and use the video user guide to get started with your surveys. Now, I want to share a couple of examples of street survey. So the first is from an organisation called Help in Suffering in Jaipur in India. And they run a classic sort of ABC intervention with a focus on sterilisation of female dogs and vaccination of all dogs. And this is one of my favourite examples of street survey data. I like it because of its simplicity, and also it shows their long-term dedication to data collection. So they use 6 routes, which they walk every 6 or 12 months on 6 consecutive mornings. And you can see Dr. Sanjay in this photo here with his clipboard, counting one of the dogs that he's observing on the routes. And they're actually using Talea now instead of pen and paper. And what you see on this graph is simply the total number of dogs seen on all of those 6 routes. And you can see there is a clear decline here in that number over time. And although I don't have the data to show you here, they have continued this counting since 1997. So now approaching 30 years. There's no complex analysis here, just the total number of dogs counted at each survey event. What makes this so powerful is their dedication to this long-term data collection and the consistency. Same routes, same time of day, same survey protocol year after year. This is a similar example from Bangkok in Thailand. Here we have NGO Soy Dog Foundation. Again, this is CNVR, but they also do provide sterilisation services for owned animals. So they use mobile clinics because their working area is really quite big and they can't therefore rely on static facilities. I also wanted to highlight their systematic approach to coverage. So they conduct CNVR on all the roaming dogs they can access within the district, ensuring they have exceeded 80% coverage before moving on to the next district. Then they're returning to the same area on a 1 to 2 year cycle to top the coverage back up to above 80%. And each time that requires fewer sterilizations to reach that threshold of 80%. And computer modeling suggests that this front loading of your effort followed by maintenance may be more effective than spreading your sterilizations evenly over time. So you end up decreasing your dog population or cat population further for the same number of sterilizations if you can front load them. Because their working area is so large, they use 20 routes, and each one of them is surveyed from a motorbike over a period of 1 to 2 hours by 2 people. Now, our first speaker today, Matt, actually completed this survey himself in 2016, and that formed the baseline for this project. And then his colleagues at Soy Dog Foundation started up annual surveys from 2020 onwards. So I wanted to do a shout out to Matt, give him credit for kicking all this off. Now, the data on nearly all these 20 routes has shown a steady decrease over time in the number of dogs per kilometre of street surveyed. And when we combine the data from those 20 routes and look at the average dogs per kilometre of street for each survey event, we can see that this has shown a very significant decline overall over time. Evidence of reduction in dog density can be really important for securing government support for CNVR, but an additional step is exploring whether this change is meaningful for citizens, which can be even more influential for an elected official. Soy Dog ran a household questionnaire last year where they approached a random sample of households and asked them a range of questions about both dog ownership practices and their perception and experience of free-roaming dogs. And one question was, how does your experience with free-roaming dogs differ today as compared to 9 years ago before the CNVR started? And of those people living in areas that have benefited from CNVR, most of them perceive the problems with dogs to be fewer today. And that's a dose-dependent effect. So the more CNVR rounds the neighbourhood had received, the more likely the resident was to say the problems had diminished. Whilst people living in areas that have not yet received CNVR, so control areas, were equally likely to say that the problems were greater today as they were to say that they were fewer. So this can be quite a powerful indicator for a government stakeholder, but household questionnaires are relatively costly to implement, especially when we consider we need to repeat these over time. So if you're planning on implementing a questionnaire, I recommend Kobo Toolbox as a data collection tool. Matt's already mentioned that, and you can see a link to Kobo Toolbox in the chat. One alternative to household questionnaires is to try and access data on complaints about dogs or cats to municipalities. Now, one challenge is that this data is not always recorded or not always easily accessible, or if it is, it may not be to the level of detail that you need. So, for example, some complaints are about nuisance or dog bites, but others may be a concern for animal welfare or a request for CNVR action. And these are clearly measuring importantly different perceptions of free-roaming animals. So my recommendation is to work with whoever within the municipality is receiving the complaints to support them to set up a robust system of data capture with clear categories of complaint type and where geographically are these complaints coming from. And try to do that as soon as possible, ideally before a CNVR project starts so that you have a baseline. You can also use street surveys to track changes in free-roaming animal welfare by scoring every animal that you see on a street survey for their basic welfare. I recommend keeping this quite simple, so going for a body condition score scale that has only 5 grades as opposed to 9, for example. So from 1, emaciated, through to 5, obese, leading to an indicator that is the percentage of the population that is in poor body condition. And when you score skin condition, just do that as the presence or absence of a visible skin problem. It's probably simpler to do that than it is to do grading of the severity of a skin problem. So with these welfare scores, it really matters that you have good inter-observer reliability. And that means all your observers score animals in the same way. And also good intra-observer reliability, which means that the same observer scores in the same way over time. And to achieve that, you need to invest in observer training and refresher training. To help you achieve that for body condition scoring, ICAM has developed a body condition scoring training and a quiz that you can access on our website and test your observers. Although I will say that testing people with real animals seen on test or pilot surveys will also be a really important part of their training. So the last indicator I wanted to talk about today is dog bites. And I think this can be a really powerful indicator because bites are obviously distressing for citizens, but also bite treatment costs money. So governments are interested if you can show that you have decreased dog bites. So this again is data from Helping Suffering in Jaipur. The publication is cited on the slide. We can see in this top graph a decline in dog bites over time. And that decline occurred despite an annual increase in the human population of nearly 5% per year. So you would have expected an increase in dog bites over time as the human population serviced by the hospital increased. This decline will be in part due to there being fewer dogs overall, and in part due to vaccination leading to fewer rabid dogs. But dogs bite for many reasons, and rabies is only a relatively small proportion of those. So they also looked at this, which is the seasonality of bites, and found that the highest bite rates occur shortly after peak whelping season. So they have a strong breeding season in Jaipur. So the proposed motivation for some of the bites was maternal defensive aggression. These were mothers protecting puppies from a perceived threat. And sterilisation through CNVR was directly taking away that motivation and therefore reducing the bites. I've got one more example of this from Bosnia in Eastern Europe. Dogs Trust Worldwide set up in Bosnia in 2012 and ran a comprehensive DPM project. It included TNVR, but it was not limited to that. They also spent a lot of effort on the owned dog population, including a very effective veterinary training program and associated marketing campaign, which has created a sustained increase in owned dog sterilisation levels. There have been a number of impacts of that DPM project, but I wanted to show this one in particular from Sarajevo, which is the capital city, where we see a reduction in dog bites reported by the main emergency medical centre. You see that reduction in blue. Now, these are not definitely not rabies related, because they have very few rabies cases in Bosnia now, but there's a strong correlation with the reduction in dog bites and in the reduction in the estimated free roaming dog population in the city, which you see in orange. One point I did want to make about both this data set and the dog bites in Jaipur is that this data comes from just one hospital. It doesn't measure all the dog bites in the city, and that's okay. This is a sample from a representative hospital, in the same way that we do not survey every street on our street surveys, but use a route that covers a sample of streets. So long as we believe that our sample is a fair representation of our wider project area, it's not biased in any way, sampling is a reasonable approach to making our monitoring affordable. So just some key takeaways to finish. We see TNVR as an incredibly impactful part of both dog and cat population management systems, but it does have to be alongside other services to be effective. We can use robust and repeated methods of measurement to provide data on indicators. Those indicators measure our progress on impacts and can be used to evaluate whether our intervention is working and establish support, including government supports for its continuation or indeed its launch, if you're using data from other places to inspire a new TNVR project in your area. I've described just 3 methods today, so there are many others that you can read about in our Are We Making a Difference guide. I talked about street surveys, questionnaire data or accessing complaint data, and accessing bite data. In order to decide where to put your measurement effort, I suggest taking time to understand what your government really cares about. And Matt talked about this earlier, these arguments that we need to use to our benefit. Which impact would they be most influenced by if you could show evidence of its progress, and maybe focus a bit more of your effort in those areas? So that's it. Many thanks for your time and attention today. Please do take a look at the resources on our ICAM website, including the Talea webinar. Do consider coming along to our conference. I'm going to keep plugging that one. It's just under 2 weeks. I'm not panicking yet. I will be. And I'm really happy to answer any questions you have today.
Awesome. Thank you so much for that, Dr. Elly. That was a fantastic overview. And a few of the takeaways I took, well, number one, I'm going to fangirl over your graphics. I think they're amazing. The one of the DPM ecosystem and where TNVR fits in, but with all the other things that you need to consider as well. I thought that was really cool. And I think for the theme of AfA Connect today is insurmountable challenges. And you've demonstrated that data collection doesn't need to be necessarily big and fancy, and something that with the right tools, everyone can achieve really, really well. So I'm going to invite Matt back as well, and we've got some questions from our audience that we're going to jump straight into. Let me find the right screen I need to share. If anyone has any questions, please make sure you keep adding them into the chat. I'm having trouble sharing my screen, so I'm just going to continue with our beautiful faces on the screen instead. So our first question that we had from someone in the chat was from Altamush. Sorry if I've mispronounced your name. They're asking, how do you create a network where orgs want to collaborate? In Pakistan, in their example, it's been really hard to bring everyone together to collaborate. What tips and tricks would you have for that?
Elly, do you want to go first? Or shall I have a go?
Sure, I will do. Just as I'm probably going to cheat by saying I'll not give you the. It's challenging to come up with a top tip on that, but the HCD, the Humane Community Development training course that you can get free online from the ICAM. It's a really useful tool because it takes you through a process of how you can be a mentor for a group. And it starts with establishing a shared appreciation of goals, so that quite often we're more similar in our goals than we realize, and sometimes the way to get there is where the differences come in. And so it does start with a lot of emphasis on trying to establish a common goal and a common vision for success. So I think that HCD course might be really useful, because it not only does it give you some sort of guidance on the different steps to take, it's actually got some practical tools as well, little sort of participatory tools that you can take your group through. So I think I would lean on that for some ideas.
Yeah, and I think I'd add that it depends on sort of who is leading it and what you want to get out of it. I mean, often we would find that we extend invitations to meetings to other groups if we're having stakeholder meetings or we're doing a workshop or an event, or whatever, just sitting down with people. You know, a good example is just often things through email or messaging or, you know, various other online tools are amazing. Like, this is facilitated and is really effective, but it's not quite the same as actually sitting with people. You know, it doesn't take much to kind of get a group of people together and say, how can we sort of help each other? What is it that you want to do? And just make that basic connection. And then, as Elly rightly said, lean out and look at those resources to actually structure that. And if you're really struggling, I would say, with coordinating networks or coalitions, see if there is somebody who can maybe mediate, who is removed from the kind of emotion and the sort of immediate environment, and help them navigate a conversation for you to try where you have some mutual aims.
And I think that's where I can plug AfA there. We're currently hiring for a new dog and cat coalition coordinator to do that exact thing. You know, we can be that neutral facilitator in the middle to bring together things, because in the animal world, there can often be some egos. There's some people competing for funding. There's a lot of challenges. So to have a mediator in the middle, I think that's really effective. And I want to thank you both also for providing so many tools. Our chat has been full of people really appreciating all the tools that you've shared. So it's fantastic that you've got such a great group of resources. Another question we had come through was, have you ever, this was from Patrick, have you ever come up against a government, whether it be local or national, that when presented with this evidence and this data that you've had, took the view to quote, well, you would say that you're an animal welfare organization. And if you have, how have you overcome that?
I can start with this one. Yes, a lot. You know, and it's a good point because, and I think this is why, you know, Elly mentioned it, the brilliant example with the dog bite reduction from Jaipur, like this, you can kind of take the animal welfare out of it. I think in terms of advocacy, for me, it's really evolved over the last 15 years as to what mechanism I use to communicate. For the most part, talking about population management, dog or cat or otherwise, the animals are kind of the lesser part of the conversation, sad to say. That's not our primary objective, but let's say if we look in Cambodia, where rabies is still endemic, you still have a high number of children, particularly, who die from rabies, who don't have access to vaccination, who are bitten by dogs, and dogs then become kind of persecuted, but the problem isn't being resolved. So then you can look at that problem and you can zoom out and say, this isn't about animal welfare, this is about children being safe. You know, stop them being bitten, stop them and to do that, we need to do X, Y, Z. Here is all the data. And often, I think sometimes if there's a regional example where it's successful, I think this is why like model programs, and Bangkok's a perfect example, Jaipur as well, where you can say, this has worked in other places. You can check the data yourself, and we can prove then that the impacts are benefiting people, and you know, the animal, this sort of welfare conversation is removed. I think where that's more difficult, at least here, is in shelters. So when you're talking about kind of overcrowded and overpopulated shelters, we are talking about it from an animal welfare perspective. But there is still a practical argument to say, okay, you're in a city, that city, we've done a survey, you know, a street survey following these protocols. Let's say there's 8,000 or 10,000 dogs. You have one shelter which has the capacity for 500 dogs. You cannot fix your problem by building more shelters. Even if you build massive shelters, they will outpace you. The reproduction will be quicker than you can build the shelter. So then it becomes it's animal welfare, because the shelters generally like that are quite terrible, but we're also speaking to the kind of economic failure of that model. Like, you're just wasting your money. There's no point. Spend the money on sterilization, and we can, hopefully open the conversation that way. So,
Yeah, I think that links back to one of the points that Ellie had before, is keeping that your eye on the horizon and finding the right metric. I've heard other examples throughout Asia of people who are trying to both control population outside of, a sanctuary, and then having sanctuaries themselves. And so many resources get taken into that area, into feeding and caring for animals individually. And I think, like, as you said, it's right. It's at doing that research and finding the right metric in which you can, pinpoint with the government agency. This is something that's going to affect communities. This is something that's going to affect rabies, etc., and health issues. Ellie,
And that's why it's important to find out which is the right agency that you're talking to, because if you're looking, if you're talking to, take an example from Thailand, there are two different responsible agencies for sort of population management and for rabies control. You would think it would be the same, but it isn't, and they kind of run parallel to each other. So you then need to kind of modify your conversation for each one. There's no point going and talking to the rabies people about waste management or other kind of shelter resources. Don't care. But again, it's then saying to them, well, you want to eliminate rabies, you want to control populations. We need to bridge that gap and sort of facilitate those conversations as well. So finding who the right people are, I think, is important.
Yeah, absolutely. And I think, again, it's that context of, you've got all these amazing models and examples, and then putting them into a local context that is for your area. Sorry, Dr. Elly, I cut you off.
No problem at all. Just to follow on from, I think what Matt is describing there really is like a stakeholder analysis. So who are your stakeholders that really matter, and then really just taking a bit of time before you get to that meeting to understand what their motivations are, so that you're not surprised when they turn around and say, "Well, animal welfare." The other thing I would say is, don't go alone. So I've definitely had that experience of being in a meeting and someone saying, yes, we would, because you're animal welfare. But if you can be there, not just as animal welfare, but being in a coalition with people who more formally represent public health, for example. So I've commonly gone with epidemiologists, so we can talk more clearly about, that their expertise is in rabies control and in human health, and they're saying the same thing. So if you can create a small collection of people that can represent more formally those different enabling arguments, then I think that's really helpful. One thing I will say, think that the enabling arguments are really important. You're trying to find the argument that's going to matter to the stakeholder, the government department that you're speaking to. But I think don't be ashamed that you are motivated by animal welfare. That's okay as well. So I don't think we ever go in with only animal welfare, but neither do we hide it. Because I think if we look again at that bigger picture, that bigger movement, our ethical position that animals matter and are sentient beings is not something to be ashamed of, and something that always needs to be bubbling along within our enabling arguments around human health and One Health and so on. But it's important that we're not ashamed to say we are in this for the animals as well as the people.
Yeah, well absolutely. Sorry.
No, just well said. Yeah, couldn't agree more.
Absolutely well said. Yeah, I think you've again highlighted why coalitions are so important. Everyone may have their specific area of interest or what they want to achieve, but there's a synergy between everything that lines up to actually everyone's getting the same outcome at the end of the day, which is fantastic. We have another question. We actually have a couple of questions that are sort of combining into one, so I'm going to try and put it together. I know from my experience in the wildlife rescue world is that you often find governments rely really heavily on the NGOs to take the responsibility and to, in less words, to do the job for them. So how do we help governments to pay more attention and engage with governments more to show them that this is a priority? And it's not just something NGOs are going to be doing for free forever. We can certainly play a role and help and demonstrate, but it's everyone's fighting for funding as well. So how do you get them to direct more funding to TNVR programs?
Well, I think using some of the enabling arguments we've talked about so far, so the One Health and so on, and trying to pull in some of those policy documents that that speak directly to them. So if you're trying to establish that the veterinary department or Ministry of Agriculture should be investing in it, you need to be showing them that WOA standard. So that WOA standard says that they are responsible for dog population management and that they should be doing it in a humane way, and it specifically calls out TNVR within it. So I think they know that. I think they know that they have a responsibility as well. I think we are often our own worst enemy, because we will jump in there and try and say, we can do this for you. We can show you how it works. And I think probably the onus has to be on us on how we present ourselves. We need to be presenting as partners. We've got the skills, you have the money, you have the responsibility. We can work together and do this very effectively. So I think whenever I talk about dog population dynamics and I talk about all these different, I mean, it is a fairly wicked problem. It has got several elements to it. You do need a comprehensive set of services, and I'm always nervous that I don't want NGOs to go, wow, I've got to do all this stuff. No, you don't. You don't have to do all this stuff, but you need to be clear that there are all these different parts and find which part of that puzzle you want to be part of, and to maybe to lead on as the expert, but always go in there asking them for money, saying, this is your responsibility. You have money to fund this. I've got the ability to implement it, and to start from that basis, rather than always going in saying we can do everything for you. And I think international animal welfare organisations have probably been the worst at doing that, in that we're really good at dropping in saying, well, we can find the money to do this project. And we set the NGO movement up to fail in some ways by giving too much for free, a kind of toxic charity.
So how would you get out of that situation then, if it's already been set up? Or is that too spicy of a question?
No, I think I can have a little go at that, because I work for an international NGO and we have had a similar experience, and you're at least spot on. It then becomes a kind of sort of codependent relationship that can be hard to sort of move away from. So what we're doing is we try and acknowledge that there is still a lack of priority and a lack of resource allocated. So then the question becomes, well, what do you need? And if we're going to invest money, rather than us just running the program for you, maybe we can do, like on a couple of the slides I had, running these training and capacity building programs. Because if we say, well, you've got the money, you could do the program, if you can get the honest feedback that is like, we don't really know how to, or we don't have the money, or we don't know how it works, or the way that we're doing it is inefficient, then we can say, well, we can put money into training and so developing skills and doing these models and being able to kind of cascade that knowledge throughout the sort of national network. But then we make it very clear that we are working and sort of training together with the ultimate aim, like it is going to be your responsibility, and then we'll hand it over. A lot of our programs in Eastern Europe have been really successful at doing that. It's different in some of those places where legislation mandates CNVR, which is really good, because then you have a stronger argument. You can say, well, you are legally responsible to implement these programs, but we can help you front load, as Elly referenced in her program. We can help you get ahead and get started, but we're not going to do it forever. And then we can kind of replicate that model. I think the other one to think about, this maybe goes to sort of a higher level, is the overall economic impact of badly managed programs. I think something that all of us in this space could do more of is kind of work with economists and work with people to say, well, what is the cost of all these bites and shelters? And what does that actually cost you versus what would implementing a humane sustainable program cost? Because ultimately it's about money overall, right? It's money and efficacy of impact. So if we could say what you're doing feels like you're saving money, but it's actually wasting it, then you would have some more leverage maybe to get them to change.
Yeah, absolutely. We just had a really interesting question coming in. This is a bit of area that I'm starting to move into. How can we strengthen our advocacy by involving civil society to make governments accountable for animal health, and essentially getting social license to do these programs in this community, in communities, I should say?
Yeah, that is a tricky question. I think it would come down to your legislation and the kind of scope of legislation that you have in the area. I could give a good example from Indonesia. So Indonesia is it's an archipelago of islands, and it's managed with all these different types of regional, provincial legislation. Then you go to Bali, that even has legislation down to the village level. So then that makes it really tricky to do what would be the normal process of how do we get a national ban or a national legislation about something, because it's not going to be implemented that easily. Whereas if you then look to say, well, what are these traditional kind of laws or legislations or village legislations that can be managed in a smaller community space, then you could sort of, I think this is in that direction, you could then leverage that model and say, well, look, we've engaged at this civil level, we've connected with all these various other responsible bodies, and it's working, and it's successful, and it's functional. Then you can sort of use that as a positive example. But I think it is a good question. I think in animal welfare we should consider more close coordination with social development, with civil societies, with sustainable development organizations, because again, a lot of these problems with animals, particularly companion animals and communities, you have to work with the communities, and they'll have their own social, economic, political problems. So it's not this kind of one without the other. So certainly that is a great question. I think more should be done in that space moving forward.
Yeah, there's so much crossover here. Like when we look at, say, the wildlife trade, for instance, there's been so many capacity programs for many years that are like, let's get the judicial system on board, border forces on board, police is on board. They all have these capacity trainings and whatnot, but then there's not often the political pressure to then continue to fund these programs. So there's now a push to actually get civil society organizations to go like, there's responsibility here. We want you to act on these things. And I think this is very similar in this situation to go like, if communities want it, if civil service organizations want it, hopefully that pressure on the government will help. Elly, did you have anything to add?
No, I think it's all been pretty much said, but I guess just one additional point is that because the species that we're looking at are naturally living with human populations, they're so that One Health, One Welfare framework fits this area of work so neatly. There's so many good examples of how you did that sort of healthy animals within that family unit or in that community unit, if we're talking about community animals, can very directly benefit the health of people. So we've got some very good evidence and some neat examples for our particular species of dogs and cats that show that they are relevant to this One Health concept.
I think that's a really good point. We had another question from Sunny in the chat. He was asking, how do we strengthen advocacy in the context of One Health and One Welfare framework? And I think you just said that there are examples out there that we can share and that we can use. And
I mean, the rabies example is a fabulous one for dogs. I mean, I think I've heard WHO staff talk about rabies as the poster child for One Health. So from the human health perspective, they're like, it's the perfect example. If you can keep these dogs healthier and vaccinated against rabies, you solve rabies within people. It's such a neat example. So we should lean quite heavily on that particular example, I think.
Do you think
when you
do? Oh, sorry.
No, I was going to say when you design these interventions and programs, be realistic in the kind of span of time that it would take, I think, as well. So rabies being that perfect example, it's achievable in a shorter time with a higher investment. But then when you look at the sort of the amount of investment that is currently available, well, it's solvable, but then you're looking at 5 to 10 years, not the next 1 to 2 years. Yeah. But in 5 to 10 years, your problem is kind of still exponentially increasing. So it's also sort of, it needs to be bespoke, all these situations. There is a principle that works for One Health, and there's a principle for all these things, but then you have to curate it depending on where you are applying those programs and the kind of context and the situation that you're in. But you can also look to cross over with other fields of work. Elliot, you're talking about wild animals. There's trafficking networks for wild animals that will intersect with other trade and traffic of different animals. There's interspecies sale and slaughter at markets. Specifically, Indonesia is very well known for that. China as well, where you have lots of these animal welfare issues kind of clashing, again, coming under this kind of One Health umbrella of like, well, all of these points, are leading into this difficult situation. So the more that you can pick things out, the easier the other ones should be to solve, you would hope.
Do you think governments are fully on board with and integrating One Health principles into their plans? Like, is everyone on board with it that you speak to? Everyone's aware of it? Is it something that's becoming really obvious, maybe especially after COVID?
I think so. I think I think it's having a moment of popularity as a concept. So I think we can lean. This is a good time to be leaning on that One Health argument, because it is being discussed for the pandemic fund, for example, the pandemic treaty, which is very much following on from the COVID days. I think that the argument is very much on the principle, but as Matt pointed out a moment ago, it's a principle that then needs to be curated and acted on. And so I think what we can do is use our companion animal work as really good examples of One Health in action. So it's quite a simple, immediate. I know that in the long term, if you want to change rabies cases, you're looking at many years, but there is some smaller community level direct obvious benefits to families to have a healthier dog and cat population that we can lean into.
Do you think that, I mean, Matt, you mentioned COVID briefly in your presentation before. Do you think, despite how horrible COVID was for many people and many projects around the world, do you think maybe COVID has also had a slightly positive impact because people now see how transmission works, people understand disease a little bit more? Do you think that's helped your programs? It's a
I
very
think
hard
that's
one to say. Like, I don't want to say
no,
COVID was a great thing, but
it's
do
a
you
good
think
question.
people understand it more now, like
Yeah.
what the connections are between people and animals and world health, etc.?
I would say yes and no. So I'm going to have like a moment of optimism and a moment of skepticism, just to even myself out. Yes, there is more of an awareness, and as Elly well put, the pandemics treaty, an awareness of emerging pandemics and zoonosis and the kind of intersection between animals and people. I think that's been a good thing, and I think that's put that more into the public consciousness. I do think as well that One Health can be prime territory for kind of corporate and governmental greenwashing, and not necessarily implementing those programs in a deep and thoughtful enough level to just say, well, we're doing a One Health thing, but how deep does that rabbit hole go? And are you prepared to really go down it? And then I would say on the skeptical side of it, there's a lot of the problem of kind of vaccine fear and the kind of
Okay. Yes.
pseudoscience, kind of internet reaction to vaccines we have seen in some of our community
It's a very
programs.
politically correct way of putting it, how you described
There we
it.
go. Yeah, well, we're an official platform, but yeah, people are resistant to having their animals vaccinated,
Wow.
and that's always kind of been the case. But I would say there's kind of citizen science should be advocated for. People should think critically and skeptically about everything that is happening, but being mindful of the way that information presents and then the impact it has on people when their principal media is through Facebook or YouTube or things that can be easily swayed and biased. So then in some regards, it's harder work to advocate for sterilizing and vaccinating animals in the wake of that. So it really depends, and kind of goes both ways. But it has certainly shaken up public discourse in I would say overall a positive way. Although practically speaking, we had a dip. There's an interesting paper which I can share a link to about just a lack of supply of rabies vaccines when the world was producing COVID vaccines, which impacted some of our programs around the world as well. So yeah, just the lack of actual PPE and resource and vaccine vials was the thing that kind of caught everybody by surprise, I think.
That brings us towards the end of our session today. That was a really great discussion, I think. That was fantastic. I want to thank everyone in the chat as well, because there was a lot of questions being thrown in, a lot of extra resources being shared. So thanks for everyone for being really engaged. Did either of you have any final closing comments today?
I wanted to mention that, and I know that Sonny's just put a comment in the chat that talked about the State of Animal Welfare Address, which is a document that the Four Paws have just put together. This is an interesting year. I think it's going to be the largest number of elections around the world is happening this year. So it's an intriguing time to be flexing our I think quite close connection with the public. So we're talking about companion animals here, and I think there is sometimes a perspective of kind of, oh, they're not as exciting as wild animals, they're not as economically important as farm animals, but when it comes to the public, they really matter. It's a daily concern for them, and so actually dog and cat population management can be a really strong election issue, and you can find quite a lot of public support for humane treatment of dogs and cats through population management done well. So I think this is the year to really flex that and utilise, I think, what is a natural public support for our approach to humane population management of dogs and cats.
Awesome.
Yeah,
thank you very much for those comments, guys, and thank you so much for your participation today. Let me see if I can share my screen again properly. Never wants to go efficiently. Okay, everyone can see my screen. Oh, there's the Q&A page we're meant to have. Oh, I don't know where that music's coming from. Sorry, everyone. We want to thank everyone for attending today. Your feedback is really important to us, both our speakers and our people who joined us. So there should be a link in the chat now for you guys to fill out this survey form or to scan that QR code so that we can make sure future events are really applicable to your work in your organizations. We do have 2 more AfA Connects. We're halfway through for the year. We have 2 more AfA Connects coming up in August and November, where we'll be talking in August about the power of community and sharing skills, experiences, and resources. And then in November, we have our final session for 2024 of Communication Matters and How to Unite the Movement. So check out asiaforanimals.com/connect and the link in the chat on how to register. And those who are members will also receive that in their inbox in their updates. We have a few more in-person events this year. In Hanoi in October, we have Asia Farm Animal Day, and we have a couple of regional events coming up. At the end of this month, we have an in-person regional Farm Animal Coalition event in the Philippines on June 28, and we have another one in India, which is to be confirmed, but within this year. So again, the links for anyone who's interested is down the bottom. In 2024, Asia for Animals also launched our very own podcast. So while you're driving the car or trying to go to sleep at night, you can download any of our podcasts at any of the main streaming platforms. We cover a whole range of issues from all of our different working groups. So there's something for absolutely everybody in there. And finally, on behalf of Asia for Animals and all our members, we really want to say thank you to our speakers for joining us today. We really appreciate your time to share all the lessons that you guys have learned over the years. And also thank you for everyone who attended today. We'll really appreciate you guys coming and attending. And again, as I said, being so active in the chat. So thank you very much. If anyone needs more information, you can go to asiaforanimals.com or you can contact me directly and I can direct you to where we can provide help for you guys. So again, thank you, Elly. Thank you, Matt, for your participation today.
Thanks, Elliot. Thank you, everyone.
Thank you.